is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. I always love highlighting amazing patients who get amazing results. And there's a couple of common themes when we have these patients. One is they're patients that do all the things that we ask them to do. And I have three things that I say always make for a great, successful patient. One is for them to keep their teeth clean, and Andrew here did that. The second is that they don't break things, and I don't think Andrew broke anything as we went through treatment. And the third is that you follow instructions, and Andrew certainly did a great job of that. There is a fourth component which we'll talk about in just a minute, but let me show you what happened in Andrew's treatment. Andrew was in braces for 14 months, and the magnitude of change that we achieved in 14 months is absolutely incredible. So here he is at the start, and Andrew was coming in more just for a nicer smile. He didn't like how this one tooth stuck out right there, and he wanted to see what he could do to improve his smile. As we look closely at what his teeth looked like when we started, I love creating beautiful smiles. It's my favorite thing to do. It is absolutely the joy of what I get to do every day is giving people the confidence to smile more fully and really just be who they are and not be ashamed to smile. But when I looked at Andrew's teeth, the thing that most concerned me was the amount of overlap between the upper front teeth and the lower front teeth. In fact, when you look right here and Andrew's biting down, you can't even see his lower front teeth. We call this a deep bite. And the reason why deep bites are important to fix is because if I didn't treat Andrew now, and if I saw Andrew in 30 years, I'll bet his front teeth would be very, very worn down. His upper front teeth might be sheared off. The lower front teeth almost certainly would be sheared down. And there are very few treatments once the teeth get sheared down like that. You can't successfully add filling material to them very easily because that filling material will often break off. It is difficult to do crowns on those teeth or caps on those teeth because there's just not a lot of tooth to put them onto. And so it can be a very difficult restorative process when teeth get really worn down. It of course also costs a lot of money. So if we can protect teeth from being worn down, then that's a huge benefit. So that was one of my number one objectives with Andrew's treatment, was to get less overlap between the upper and the lower front teeth to be able to start to see some of the lower front teeth. Now, another goal in Andrew's treatment was to correct the bite in the back. And so if you look at these blue lines, this shows you that this canine tooth really belongs right back here. And this red line, kind of this cusp tip, we call it, this mountaintop on this upper tooth, really belongs back here in the center of the lower teeth. Now, you don't see a big overbite on Andrew, and that's because his upper front teeth are tucked way back. This is kind of a classic appearance. Lots of people have this. We even have a name for this. And if all you do is straighten the teeth, then you'll see that he actually has quite a significant overbite. And it's because of the way that the teeth fit together in the back of the mouth. And so we want to see if we can correct the bite in the back while also, of course, getting the teeth in the front to look good and reducing the overbite. So we used braces in Andrew's case, as I told you, start to finish, 14 months. And here's the change in the back of the bite. I did not get these lines all the way lined up like I would have preferred to. I ran out of space in the front of the mouth. Sometimes the upper teeth and the lower teeth are not ideally suited for each other. So we got really, really close. This is still a very great bite, but not quite perfect. I'm more proud of what we did in the front of the mouth, and you can see how we got much less overlap of these upper front teeth to the lower front teeth. You can now see probably about 75% of these lower front teeth, and so I'm really excited about that. I also love the way that it looks. This is just a beautiful result, and especially the way that it looks on Andrew. So this is just a really, really fantastic smile. And of course, this is a post smile, but here's Andrew at the end of treatment. He somehow got taller than me during treatment, or maybe it's just the curls in his hair. But what a great looking smile, what a confident smile, and that's really the joy. Of course, Andrew also grew during treatment, and you can see that from his face. You can see that in terms of how tall he is. And that growth is one of the reasons why treatment went so fast. This is one reason why we like to treat kids when they're growing, and why we like to see kids before they hit their major growth spurts, because sometimes we can time our treatment and really coordinate it with their growth and really harness the growth potential that's in the body to make these big changes happen. So the magnitude of change in a front to back way and getting rid of that overbite, in an up-down way, making sure that those front teeth overlap less to give him protection so that they're not worn down later in life. Those are amazing changes in 14 months. And like I said at the very beginning, we can't do those things without a great partner in treatment like Andrew, but we also are aided by the fact that he was growing. And so that's why we like to do orthodontics in growing children. So anyway, what a great result. We're super happy for Andrew. He's also just the best guy, and we really enjoyed all of his visits in the office. And I think you're gonna see this guy going and doing great things someday. So look out for this smile. He's gonna be amazing. All right, take care. Hope you enjoyed that video, and hope you learned what can be done with amazing partners in orthodontics. Thanks so much.